Vitamin B12, also known as cobalamin. So vitamin B12 is a very important vitamin that is used by the body. It's primarily found in animal-based products. Think of meat such as beef and chicken, got a high abundance in liver. Think of fish such as salmon, trout, tuna. Some shellfish also have vitamin B12. We have the dairy products such as milk, cheese, yogurt, and we also have this in eggs. Now, vegans have a difficult time finding vitamin B12 because it doesn't occur in plant foods. So they usually have to seek vitamin B12 from fortified foods such as cereals, grains, soy products, or plant milks. Now, vitamin B12 is absorbed from the stomach. Through a variety of chemical reactions, it's taken up by the cells and used for cellular processing and synthesizing DNA. There's a lot of barriers in the way of vitamin B12 absorption, and one of the common ones is surgery. If you've been through bypass, like a gastric bypass or a gastric resection, you've just removed a large portion of the stomach, thereby preventing a normal absorption of vitamin B12. And in that case, you'll have to start taking vitamin B12 supplementation. Patients who go through a gastric bypass and a gastric resection for any reason often are deficient in other vitamins as well, and so they also have to take them. There are some medications that can inhibit your ability to pick up vitamin B12. Metformin is a common diabetic drug, and up to a third of patients on metformin can end up developing vitamin B12 deficiency. They have to be checked. There are other drugs such as proton pump inhibitors, what we call PPIs. Think of omeprazole, also known as Prilosec, and esomeprazole, also known as Nexium. They're great drugs. They help reduce acid production, which is a help for people who have GERD or reflux, but they can inhibit B12 uptake. And then chronic pancreatitis, and also think of inflammatory bowel disease such as ulcerative colitis and Crohn's. They can inhibit B12 uptake by your cells and absorption. So vitamin B12 is very easy to detect. So it is easy to check. You just offer a sample of blood, and it is very easy to also treat. Your physician, after discussing your risks and benefits, will decide if it's appropriate to check you for vitamin B12 deficiency. It doesn't take any time at all to collect the blood to run the test. And then they will be the ones to decide which version of vitamin B12 you need, the pill or the injections. So in a nutshell, that's vitamin B12. If you have any questions, please post below. Until next time.